51. Which brain structure is primarily responsible for memory consolidation? Answer: hippocampus. Explanation: the hippocampus consolidates short-term memories into long-term storage, critical for assessing cognitive deficits in neurological disorders like Alzheimer's disease. 52. What is the priority nursing action for a patient with a suspected increase in intracranial pressure? Answer: notify the healthcare provider. Explanation: notifying the healthcare provider ensures rapid intervention for increased intracranial pressure, a critical step to prevent neurological deterioration and ensure patient safety. 53. Which cranial nerve is assessed by asking a patient to clench their teeth? Answer: trigeminal nerve. Explanation: the trigeminal nerve controls mastication muscles, assessed by teeth clenching, a key test for neurological motor function in clinical evaluations. 54. What is the primary symptom of a patient with a stroke in the right cerebral hemisphere? Answer: left-sided weakness. Explanation: the right cerebral hemisphere controls the left side of the body, so a stroke causes left-sided weakness, guiding neurological assessment and rehabilitation planning. 55. Which reflex is tested by tapping the triceps tendon? Answer: triceps reflex. Explanation: the triceps reflex, elicited by tapping the triceps tendon, assesses the C6, C7 spinal segments, critical for evaluating neurological motor function in the upper limbs. 56. What is the primary purpose of administering tissue plasminogen activator to a stroke patient? Answer: dissolve blood clots. Explanation: tissue plasminogen activator dissolves clots in ischemic stroke, restoring cerebral blood flow, a critical intervention to minimize neurological damage and improve outcomes. 57. Which cranial nerve is responsible for balance? Answer: vestibulocochlear nerve. Explanation: the vestibulocochlear nerve's vestibular branch detects head position, assessed for balance, critical for preventing falls in neurological patients. 58. What is the most appropriate nursing intervention for a patient with a Glasgow Coma Scale score of 10? Answer: frequent neurological assessments. Explanation: a score of 10 indicates moderate impairment, requiring frequent neurological assessments to detect changes and ensure timely interventions for patient safety. 59. Which brain area is responsible for processing visual information? Answer: occipital lobe. Explanation: the occipital lobe's visual cortex processes visual input, assessed to detect neurological deficits like visual field loss in clinical practice. 60. What is the primary nursing action for a patient experiencing status epilepticus? Answer: administer lorazepam as prescribed. Explanation: lorazepam stops prolonged seizures in status epilepticus, a critical intervention to prevent neurological injury and ensure patient safety. 61. Which spinal segments are tested by the brachioradialis reflex? Answer: C5, C6. Explanation: the brachioradialis reflex assesses the C5, C6 spinal segments, a key deep tendon reflex for evaluating neurological motor function in the upper limbs. 62. What is the primary function of the basal ganglia? Answer: modulate voluntary movement. Explanation: the basal ganglia regulate smooth voluntary movements, critical for assessing neurological conditions like Parkinson's disease in clinical settings. 63. Which cranial nerve is assessed by observing facial symmetry during a smile? Answer: facial nerve. Explanation: the facial nerve controls facial muscles, assessed for symmetry to detect neurological deficits like facial paralysis, ensuring accurate clinical evaluation. 64. What is the primary goal of physical therapy for a patient with a spinal cord injury? Answer: maximize functional independence. Explanation: physical therapy enhances mobility and self-care in spinal cord injury patients, a critical intervention to improve quality of life and neurological outcomes. 65. Which brain structure regulates heart rate? Answer: medulla oblongata. Explanation: the medulla oblongata controls heart rate via autonomic centers, critical for monitoring vital signs in neurological patients to ensure stability. 66. What is the primary nursing intervention for a patient with a migraine headache? Answer: provide a quiet, dark environment. Explanation: a quiet, dark environment reduces sensory stimuli, alleviating migraine symptoms, a key intervention for neurological patient comfort and safety. 67. Which cranial nerve is responsible for taste on the posterior third of the tongue? Answer: glossopharyngeal nerve. Explanation: the glossopharyngeal nerve controls taste on the posterior tongue, assessed to detect neurological sensory deficits in clinical examinations. 68. What is the primary symptom of a patient with multiple sclerosis? Answer: muscle weakness. Explanation: muscle weakness, due to demyelination in multiple sclerosis, guides neurological assessments and interventions to support patient safety and mobility. 69. Which reflex is tested by tapping the patellar tendon? Answer: patellar reflex. Explanation: the patellar reflex, elicited by tapping the patellar tendon, assesses the L2, L4 spinal segments, critical for neurological motor function evaluation. 70. What is the primary purpose of a CT scan in a patient with a suspected stroke? Answer: identify hemorrhage or ischemia. Explanation: a CT scan distinguishes between hemorrhagic and ischemic stroke, guiding neurological treatment to prevent further damage and ensure patient safety. 71. Which cranial nerve controls pupil dilation? Answer: sympathetic nervous system. Explanation: the sympathetic nervous system, not a cranial nerve, controls pupil dilation, assessed to evaluate neurological autonomic function in clinical settings. 72. What is the primary nursing action for a patient with a suspected transient ischemic attack? Answer: monitor neurological status. Explanation: monitoring neurological status detects changes after a transient ischemic attack, guiding interventions to prevent stroke and ensure patient safety. 73. Which brain area is responsible for processing auditory information? Answer: temporal lobe. Explanation: the temporal lobe's auditory cortex processes sound, assessed to detect neurological deficits like hearing loss in clinical evaluations. 74. What is the primary purpose of administering levetiracetam to a neurological patient? Answer: prevent seizures. Explanation: levetiracetam, an anticonvulsant, prevents seizures, a critical intervention for stabilizing neurological patients and ensuring safety. 75. Which cranial nerve is assessed by asking a patient to puff out their cheeks? Answer: facial nerve. Explanation: the facial nerve controls cheek muscles, assessed for symmetry and strength, a key test for neurological motor function in clinical exams. 76. What is the primary symptom of a patient with a cerebellar injury? Answer: ataxia. Explanation: ataxia, impaired coordination, results from cerebellar injury, guiding neurological assessments and safety interventions like fall prevention. 77. Which spinal segments are tested by the Achilles reflex? Answer: S1, S2. Explanation: the Achilles reflex assesses the S1, S2 spinal segments, a key deep tendon reflex for evaluating neurological function in the lower limbs. 78. What is the primary nursing intervention for a patient with a Glasgow Coma Scale score of 3? Answer: initiate emergency airway management. Explanation: a score of 3 indicates coma, requiring immediate airway management to prevent hypoxia, a critical safety intervention in neurological emergencies. 79. Which brain structure is responsible for coordinating voluntary movements? Answer: cerebellum. Explanation: the cerebellum fine-tunes voluntary movements, assessed to detect neurological deficits like tremors, ensuring safe patient mobility. 80. What is the primary purpose of a lumbar puncture in a neurological patient? Answer: obtain cerebrospinal fluid. Explanation: a lumbar puncture collects cerebrospinal fluid for analysis, aiding diagnosis of neurological conditions like meningitis, critical for patient care. 81. Which cranial nerve is responsible for shoulder elevation? Answer: accessory nerve. Explanation: the accessory nerve controls the trapezius muscle, assessed by shoulder elevation, a key test for neurological motor function in clinical exams. 82. What is the primary symptom of a patient with myasthenia gravis? Answer: muscle weakness. Explanation: muscle weakness, worsening with activity, is caused by acetylcholine receptor dysfunction, guiding neurological nursing care and safety measures. 83. Which brain area regulates sleep-wake cycles? Answer: hypothalamus. Explanation: the hypothalamus, via the suprachiasmatic nucleus, regulates sleep-wake cycles, critical for assessing neurological health and patient stability. 84. What is the primary nursing action for a patient with a suspected spinal cord injury? Answer: immobilize the spine. Explanation: immobilizing the spine prevents further neurological damage in suspected spinal cord injuries, a critical safety intervention in emergency care. 85. Which cranial nerve is assessed by testing hearing? Answer: vestibulocochlear nerve. Explanation: the vestibulocochlear nerve transmits auditory signals, assessed to evaluate neurological sensory function and guide patient communication. 86. What is the primary purpose of administering baclofen to a neurological patient? Answer: reduce muscle spasticity. Explanation: baclofen reduces muscle spasticity in conditions like multiple sclerosis, improving comfort and mobility, a key neurological nursing intervention. 87. Which brain structure modulates emotional responses? Answer: amygdala. Explanation: the amygdala regulates emotions, critical for assessing behavioral changes in neurological disorders like anxiety, guiding patient care. 88. What is the primary symptom of a patient with a stroke in the left cerebral hemisphere? Answer: right-sided weakness. Explanation: the left cerebral hemisphere controls the right side of the body, so stroke causes right-sided weakness, guiding neurological care and rehabilitation. 89. Which reflex is tested by tapping the biceps tendon? Answer: biceps reflex. Explanation: the biceps reflex, elicited by tapping the biceps tendon, assesses the C5, C6 spinal segments, critical for neurological motor function evaluation. 90. What is the primary purpose of an EEG in a neurological patient? Answer: measure brain electrical activity. Explanation: an EEG measures brain electrical activity to diagnose conditions like epilepsy, guiding neurological treatment and ensuring accurate patient care. 91. Which cranial nerve controls downward eye movement? Answer: trochlear nerve. Explanation: the trochlear nerve innervates the superior oblique muscle, assessed for downward eye movement, critical for neurological cranial nerve testing. 92. What is the primary nursing intervention for a patient with a traumatic brain injury? Answer: monitor intracranial pressure. Explanation: monitoring intracranial pressure detects complications in traumatic brain injury, a critical intervention to prevent neurological deterioration and ensure safety. 93. Which brain area is responsible for language production? Answer: Broca's area. Explanation: Broca's area in the frontal lobe governs speech production, assessed for deficits like aphasia, guiding neurological communication strategies. 94. What is the primary symptom of a patient with Guillain-Barré syndrome? Answer: ascending muscle weakness. Explanation: ascending muscle weakness is characteristic of Guillain-Barré syndrome, guiding neurological assessments and interventions to support patient safety. 95. Which cranial nerve is assessed by testing the gag reflex? Answer: glossopharyngeal nerve. Explanation: the glossopharyngeal nerve provides sensory input for the gag reflex, assessed to ensure safe swallowing in neurological patients. 96. What is the primary purpose of administering donepezil to a neurological patient? Answer: improve cognitive function. Explanation: donepezil enhances cognition in Alzheimer's disease by increasing acetylcholine, a critical intervention for managing neurological cognitive decline. 97. Which brain structure relays pain signals to the cortex? Answer: thalamus. Explanation: the thalamus relays pain signals via the spinothalamic tract, critical for assessing neurological sensory deficits in clinical evaluations. 98. What is the primary nursing action for a patient with a suspected brain tumor? Answer: perform a neurological assessment. Explanation: a neurological assessment identifies deficits caused by a brain tumor, guiding diagnosis and treatment to ensure patient safety and timely care. 99. Which cranial nerve controls pupil constriction? Answer: oculomotor nerve. Explanation: the oculomotor nerve controls pupil constriction via parasympathetic fibers, assessed to evaluate neurological function in clinical settings. 100. What is the primary symptom of a patient with a cerebellar stroke? Answer: loss of coordination. Explanation: loss of coordination, or ataxia, results from a cerebellar stroke, guiding neurological assessments and safety interventions like fall prevention.